We will get going today in terms of talking about protection and physical distancing. We want to go over some of the details with regard to what's important, why we're doing what we're doing, talking about flattening the curve, and then going over a few principles with regard to protection and physical distancing so that you understand why that is the case as our first line of defense with this COVID-19 infection. One of the things that's most important when we start talking about what's happening and why we're doing what we're doing is understanding that part of what we're doing has everything to do with what we call flattening the curve. It has everything to do with what can we do to make a difference with regard to decreasing infection. We have no treatment for this infection. We have no cure for the infection. We have no vaccine for this infection. Because it's new, we are actually learning what it does to the body, how that manifests in different people, and what kind of treatments may become available. Vaccines are being worked on. Several different regimens of medications have been tried, and many have failed. There are recommendations and suggestions based on other people using medications, using them in combination, but there has been no evidence of definitive treatment from any medication at this point in time. Today is Tuesday, April 14th, and we do not have a proven treatment for coronavirus or COVID-19 infection. Our only defense is really to reduce the number of people getting infected. And it's critical that we do that. We need to reduce the number of people getting infected, but we also need to reduce how fast new infections are showing up. There are multiple reasons for that, but the main reason is that we do not want to get in a position where we're overwhelming our healthcare system. Our healthcare system has a limited number of beds, a limited number of ventilators, a limited number of staff, and as the infection goes on, we're finding that some percentage of staff members are actually getting infected and unable to work. There are shortages with regard to medications. There are shortages with regard to protective equipment. And we need to do what we can to reduce the burden on our hospital system for the sickest patients. The other aspect of reducing that burden has to do with the fact that the average person that gets hospitalized for COVID-19 infection is hospitalized sometime in the week after they originally got infected, and they are staying in the hospital between 10 and 13 days on average. And those are the people that survive. In the United States, 25% of positive COVID-19 infections.
Move your camera down a little bit because you're really low.
Okay. Maybe I need to just back up a little bit. 25% of COVID-19 infections are ending up hospitalized. 6%, so 19% of the total number of infections go to the hospital and get respiratory support, they get oxygenation, but 6% actually have critical disease and end up on a ventilator. 50% of the patients that end up on a ventilator are dying. It is critical that we slow down the amount of cases going to the hospital because people don't recover quickly once they are hospitalized. Once someone's in the hospital, we're looking at almost 2 weeks. Those patients need rehabilitation to be able to get up and walk, to be able to eat, to be able to function. They are not back to normal by the time they are finished with their hospitalization. They are just not needing critical hospital care. And that's a big difference. The drain on our society, but more importantly, the drain on our hospital system for people being hospitalized is incredible. We need to pay attention to that. The cost of hospitalization is high, even being evaluated in the emergency room. And what we're finding, especially in New York, people are staying home. They're sick. They can't afford to go to the emergency room, and people are dying at home. Believe me, the numbers that are being reported are not adequately reporting the numbers of people who are dying from COVID-19 and not ever having reached a hospital. So please understand, physical distancing and protection are critical in managing the early stages of this disease. We need to get into great habits now, because the reality is we have another year to a year and a half to deal with outbreaks until we hopefully get an effective vaccine. So again, I don't want you to panic, but I want you to keep in mind what we're doing. When they talk about flattening the curve, we are bringing down the number of new infections, and we are slowing down how many new infections are showing up every day. And we have to do that. The main way to do that is to start to separate people, to stop being in a position where we are so close that normal breathing, normal random coughing is spreading virus around, and people are inhaling that virus. They're getting it on their hands and then touching their face, their nose, their mouth, their eyes, and getting infected. So physical distancing is key, because 6 feet is the amount of distance required for the majority of people to have very minimal exposure to the respiratory droplets from someone who is in close proximity, just with normal breathing, normal inhalation and exhalation. That is the amount of spacing we need. When someone coughs, they can cough respiratory droplets way further than 6 feet. Certainly a sneeze can go more than 10 feet. But we know those people are quote unquote sick, and we expect that they are not out in public. The reality, however, is that if you have someone that is infected with no COVID-19 symptoms, but let's say they have allergies and they cough. Let's say they are smokers and they cough. The respiratory droplets can stay in the air up to 3 hours. And we believe that the droplets, once they land on surfaces, can stay on those surfaces at least 48 hours after exposure. So 6 feet of distancing to prevent you from inhaling the respiratory droplets of people just in passing, not the ones that are coughing and sneezing, is part of the physical distancing. Not going out in public around other people if you don't have to go out is critical. And making sure that we do not have groups of people congregating so that regular respiration is releasing droplets that the people around them are inhaling. The reality is there are a large number of people who have COVID-19 infection who do not know that they are infected. And it does not mean that they can't pass on the infection. So we need you to be serious about social distancing or physical distancing, because you don't know who actually has infection. You don't know, and we don't know. So the best course of action at this point in time is simply to stay home. The second aspect of preventing new infections and slowing down the rate of infection is to talk about protection. What can you do to decrease the chances that you have respiratory droplets on your hands that you then introduce to your face? What do you do to make sure that you're not breathing in respiratory droplets that are still suspended in the air after someone else has passed by and exhaled, normal breathing, coughed because they had a tickle in their throat? How do we do that? So number one, hand washing. We have heard about this. We all snicker that we shouldn't have to be reminded to actually wash our hands, but we need to start getting into an excellent, consistent, dependable habit of washing our hands. When you come in the house, go to the sink and wash your hands. You're going to wash your hands with warm to hot water and soap. It doesn't have to be antibacterial soap. It doesn't need to be fancy, but wash your hands. Put your hands under the water, get them wet, take the soap, generate a lather, and you're going to rub your hands throughout the 20 seconds. Sing a song, set a timer, but 20 seconds. Now, I'm not demonstrating 20 seconds, but I am demonstrating how you make sure you get all of the pieces, all of the places, all of the nooks and crannies in your hands. So when I show you the back of my hand, from the tip of my fingers, you're going to take your cuticles. You want to go all the way down to the top of your wrist. When we turn around in this direction, we do the same thing. We want to go this far down or this far up, whichever direction you want to consider it, as you're washing your hands. You lather, you wash, you press, you rub, you get between the webs of your fingers, you rub the cuticles, you rub around your wrists, and then you put your hands under the water to rinse, and you let that water drip off your hands. You take a towel and you take the towel to turn off the water, and then take a clean towel and dry your hands. Now I'm saying towel, it can be a paper towel, it can be a clean towel, but it should not be a cloth towel that's been sitting around where 18 different people have come through and dried their hands and it's been sitting there for 3 or 4 days. We need to be serious about that. When we wash our hands when we come home, we wash our hands before we eat, we wash our hands really before and after we go to the bathroom, no matter what you did in the bathroom. We wash our hands whenever we are handling goods from outside. So if you are working and you're taking your clothes off and you're taking those clothes inside or washing them or putting them in the utility room, you need to wash your hands after that. If you've washed your hands, and let's say an hour ago, and all you've done is take a nap, you can get up and hand sanitize at that point. So hand sanitizer is also adequate protection for hand washing or for hand cleanliness and disinfection. When you talk about a hand sanitizer, you need to look on the bottle and make sure it has at least 60% alcohol. We tell everybody 70% because that gives you a little leeway. If you're making your own hand sanitizer, it is really important that you understand if you start out with 70% alcohol, you cannot add a lot of other things like aloe, glycerin, oils, essential oils, other scents. You can't add a lot of those things without bringing the percentage of alcohol down below 60%. So it's really important that you start out with a high enough degree of alcohol to then allow yourself to have the additives and still maintain a 70% alcohol ratio. I cannot emphasize that enough. If you are making your own hand sanitizer, once that mix is finished, the mix has to be 70% alcohol. You can't start with 70% alcohol and mix other things and maintain 70% alcohol. So please keep that in mind. Commercial hand sanitizers come in 2 forms. One are alcohol-based, and then the others are a disinfectant-based. The ones that are not alcohol are not rated for you to be able to keep your hands disinfected. So please look on the bottle of your hand sanitizer and make sure it's 70% alcohol. We talk about hand washing. Let's talk about masks. Masks are a big deal for several reasons. Number one, masks are there to protect us. They can protect you from inhaling abnormal particles. More importantly, they can protect everyone else from the potential that you have infection that you don't know about and you're breathing out respiratory particles. The initial recommendations for people to not wear masks have everything to do with the limitations in the availability of medical grade masks. We are in a shortage because of the number of COVID-19 infections. We are in a shortage because of the amount of people who have gone out and bought surgical masks, not from the hospital or anything, we understand that, but that the total supply available, a large percentage going to consumers. We wanted, or I say we, it was hoped that by not wearing masks, people would stop buying the paper masks so that they could be used within the hospital setting. Now, we're way beyond that point, and what we need to do is reduce the amount of infection in the environment. We asked the public to wear cloth masks to reduce the amount of virus that is being introduced by people who are infected or who are infected and out in public, or who are infected and don't even know they are infected. That's the most important part of wearing a mask in public. The mask is not there instead of staying home. The mask is there if you need to go out in public. For instance, going to the grocery store, going to the pharmacy, going to your local doctor's office, any of those events. If you have to, even if you have to go to work, essential personnel, having a mask on reduces the amount of droplets coming from your system out into the environment. If we can reduce the amount of virus that is circulating around in the community, then we can reduce the amount of new infections. We can slow down the number of new infections, and we won't overwhelm our healthcare system. That's really the key. We don't expect that the mask that people are wearing in public will protect them from someone coughing or sneezing in front of them who has COVID-19 infection. The amount of filtration required to prevent that is the kind of filtration that occurs in the hospital, in the intensive care unit, in the hospital, in the respiratory care units. And those type of masks, number one, should remain available for hospital personnel and critical care personnel. Making those type of masks at home are very difficult because those materials are not readily available. We can, however, do our part to reduce the amount of infection we introduce by having effective masks. I, for one, don't believe that a bandana should be something that you reach for as your first choice of a mask. If that is all you have, then obviously we would like you to use that. But you would need to use 2 or 3 layers of bandana type material to start to have a small decrease in the amount of respiratory particles that actually get out from your respiratory tract if you're infected. Denim and khaki, especially denim, have a very, very tight weave. Quilter's cotton has a very, very tight weave, and that type of material is preferred. We certainly will have you do a 2-layer mask, and there are some studies that suggest that a 2-layer mask with either a very tight weave cotton, like Quilter's cotton, a good quality cotton polyester t-shirt material, not the flimsy material, and believe it or not the 100% cotton material, but t-shirt material that's a cotton polyester blend, pillowcases, and believe it or not, tea towels, the thicker dish towels, the thicker old-fashioned lumpy dish towels that many of us know from our childhood. Those type of materials can do wonders. Now, some people are advocating cutting up a HEPA filter from a vacuum cleaner bag, and that is a possibility, but please understand that vacuum cleaner filter bags, filters from the air conditioning, are not designed for respiration. So if you make a mask with that filter, you still need to have a covering material between the filter and your mouth so that you're not breathing in microscopic particles and fibers from the mask itself. If you do that, that can lead to lung damage. And if you're damaging your lungs from your mask and then you get infected, the likelihood is that you're going to increase your chances of a severe infection. So we're doing everything we can to stay out of the hospital. Let's be mindful of what we're doing with our protection. If you use filter paper, that filter paper needs to have a covering between itself and your mouth and nose to prevent you from breathing in the fibers from the filter paper. So keep that in mind. Last but not least, gloves. Do not wear gloves. Do not wear gloves. Gloves are going to do more to increase the spread of infection because the natural tendency for people with gloves on is to touch anything they want because they feel protected and they're not paying attention to what they're touching. People who are not accustomed to wearing gloves can wear gloves, they're touching everything and they've touched their face, they've touched they contaminate themselves, they contaminate the environment around themselves, and people are less likely to wash their hands when they're wearing gloves. Gloves can be nicked, you can get a hole in your glove, and once you have a hole in your glove, it's really not protecting you because whatever's on the outside of your glove can now get on the inside, on your hands, on your fingers, and people don't wash their hands when they wear gloves because they think they're protected. So don't wear gloves. They're not helpful. It is much more likely that you will keep your hands clean and disinfected if you are walking around without gloves on. You are paying attention to what you're actually touching. You are disinfecting your hands before you touch anything in your home that you can help. I want to keep emphasizing, do not wear gloves. They are not helpful for the average person. In general, this is the set of suggestions we have when it comes to protection and physical distancing. I certainly hope that's given you additional information to help understand why we're doing what we're doing, to understand that when people do get hospitalized for a COVID-19 infection, they stay in the hospital for several weeks and can be sicker longer than that, that people who are on ventilators can stay in the hospital 3 to 4 weeks, and half of them will actually die. And certainly if we run out of ventilators, then we're going to see a sharp increase in deaths simply because we can't take care of everyone. So please do your part when it comes to physical distancing. Stay home unless you absolutely have no other choice. This is not the time for pap smears. This is not the time for well child visits. This is not the time for routine care. Call your doctor's office to find out how you can do follow-up over the phone, over a video call, and try to stay home. If you must go out, stay 6 feet away from the next person. Mind what you're touching, and by all means, do not touch your hands to your face, to your eyes, to your nose, to your mouth. I always suggest eye covering as well. If someone passes by and sneezes, those droplets, even if they cough, those droplets are in the air, and if they get into your eyes, your tear ducts go directly into your sinuses in the back of your throat, and as such, there is some small risk of infection from that area. So, we talk about masks. Yes, please wear masks. We talk about gloves. Please do not wear gloves. But wear glasses. Okay, I have droned on and on way past my 10 minutes. I hope that all is well. If you have any additional questions, please send those questions, type them in the comments below. You can send a private message to us, or you can email at contact@femalematters.com. We hope you have a fantastic day, and tomorrow we will discuss medication and treatment. Have a great evening.